Hi, my name is Monica Ocampo, and I'm a second-year dental student at Roseman University College of Dental Medicine. Presenting on role of vitamin D in cardiovascular disease. DMD is the most common cause of death globally. Many studies have investigated the association between vitamin D and cardiovascular disease, otherwise known as CVD, but literature has shown various results. The aim of this study was to investigate the role of vitamin D in CVD using a large, nationally representative sample and identify the levels of CVD that are at risk of CVD. Data was obtained from the 2015 to 2018 National Health and Nutrition Examination Survey database and included adults ages 20 years and older with a history of CVD. Descriptive statistics for participants' demographics, vitamin D levels, CVD status, and risk factors were reported. High-score tests and t-tests were performed to examine differences in participant characteristics among those who had CVD and did not have CVD. Regression models were used to explore the association between vitamin D levels and CVD. This study had just under 10,000 participants with an average age of 50 years old. Majority were female, about 52%, and about 34% were non-Hispanic white. The associations between vitamin D and CVD are summarized in this figure. Serum 23-OHD forest plots. Serum 23-OHD are a widely used marker of vitamin D status. After controlling for age, gender, and race and ethnicity, subjects with vitamin D deficiency had significantly higher odds of having CVD compared to those with normal vitamin D levels. Those with insufficient vitamin D were also more likely to have CVD than those with normal vitamin D levels. After the adjustment of age, gender, race and ethnicity, BMI, hypertension, hypocholesterolemia, diabetes and CRP levels, vitamin D deficiency, and vitamin D insufficiency remained as independent risk factors for CVD. Risk for CVD disappeared in all models for those with vitamin D adequacy. Evidence from and in support of our results suggests that further studies may encourage healthcare professionals to recommend vitamin D supplementation in the near future to decrease CVD risk and prevalence in adults. This evidence is supported by a previous study that utilized N. Haynes data from 2007 to 2008 and found that individuals with severe vitamin D deficiency were more likely to have CVD. Though statistical significance was not found in the relationship between CVD and vitamin D deficiency, Lee et al. Indicated that these circumstances could elevate the likelihood of developing CVD. The lack of statistically significant relationship between CVD and vitamin D adequacy is supported through a study which found that the risk of CVD was only higher in patients with vitamin D levels below 50 nmol per liter. Mark Hyman, a functional medicine physician, explains the reason for the lack of vitamin C deficiency in our diets. He says vitamin D isn't a vitamin. It's a hormone synthesized in the skin from sun exposure and activated in the liver and kidneys. While vitamin D supplementation is recommended, we should consider that the skin is a site for synthesis of vitamin D and a target tissue for its active metabolite. The main source of vitamin D is through sunlight, yet about half of the United States population has a deficiency according to a 2011 study, and even more so in darker ethnicities such as Blacks and Hispanics. This is because melanin absorbs ultraviolet radiation and decreases the overall vitamin D exposure as compared to those with lighter skin complexions. Since COVID-19, the number of people that have a vitamin D deficiency has probably since increased. Whether vitamin D is taken in via sun exposure, vitamin D-rich foods such as wild-caught salmon and canned wild tuna, or supplements, it is biologically inactive and must undergo 2 hydroxylation reactions to become active. The active form, known as calcitriol, is required for building healthy bone and teeth, and is involved in many roles throughout the body, such as reducing inflammation, cancer cell growth, regulating calcium and phosphorus. Vitamin D in supplements comes in 2 forms, D2 and D3. Both forms are well absorbed in the small intestine. The only difference is that D2 comes from plants and D3 comes from animals. Alternatively, a recent study showed that D2 and D3 may have overlapping effects, and D3 exhibited more stimulatory effects and may thus be more beneficial in regards to CVD. Then, both vitamin D deficiency and insufficiency were associated with an increased risk of CVD. Healthcare professionals may consider recommending the intake of vitamin D supplements to improve and prevent cardiovascular health in adults. The strength of the study is the large and nationally representative sample size available, allowing for a better estimate of the association of vitamin D and CVD. Moreover, numerous covariates were considered and adjusted in the analysis. However, some limitations include a cross-sectional study rather than a longitudinal study. Thus, causality could not be strongly inferred and interpretations are need to be made with caution. Second, the CVD history was self-reported, which might be subject to recall bias and misreporting. My presentation. I would like to thank you all for listening, and I would also like to thank Roseman University College of Dental Medicine and Clinical Outcomes Research and Education. And these are my references.